In my study of Chinese medicine, I became fascinated with the teachings of how the teeth are connected to the organs through the meridian pathways. One of the most profound examples I saw of this was during a 2012 study that was utilizing thermal imaging to track inflammation in the body. I was reviewing a torso scan where there was an extreme inflammatory process in the breast tissue on the right side. As I looked at her health history, I discovered that the patient had tried numerous therapies to resolve her health issues. With her concerted effort, I wondered why there had been no improvement in the level of inflammation in her body. In looking at the scan, I also noticed extreme redness in the lymph area on either side of the throat. I thought it would be important to investigate where the lymph problem was originating. I invited this client to be part of a 6-week study using the AMI 750, Channel 3, which is known to reduce inflammation. We were using thermal imaging to develop a more in-depth study to include the oral and chest cavities. Her images revealed significant inflammation on the right side of the oral cavity. In Chinese medicine, this would be seen as a convincing correlation, as from the scan it appeared that the inflammation or possible infection in her oral cavity was directly connected to the inflammation in her right breast. After 6 weeks, with a total of 20 sessions with the AMI 750, we were able to see a measurable reduction in the inflammation in her breast and also in the oral cavity. This was accomplished with all sessions being administered through the portals of the feet, utilizing the meridian pathways. This inspired me even more to search for the causes of illness in the Sima technology case studies by utilizing the wisdom of Chinese medicine. This knowledge was helping me to understand why some people couldn't resolve their health issues with Western medicine alone. In recent years, modern researchers have begun to investigate how dental health issues can have a profound impact on overall health and well-being. There are actually more than 2,000 published studies which link infections in the oral cavity to bacteria found in the cardiovascular and respiratory systems, along with connections to many other degenerative diseases. When I looked closely at the average person's dental problems, it seemed that most common issues were chronic gum disease, the negative impact of dental procedures, crowns, bridges, and root canals that may harbor hidden infections. I wanted to examine how the AMI 750, which so effectively transmits sound along the meridian pathways, could be used to help alleviate dental issues and improve communication between the teeth and the organs. I knew that Channel 3, which diminishes the inflammatory process, and Channel 6, that supports the immune system, had proven to be very effective in resolving other health issues. I wanted to find out what their impact would be on common dental challenges. I began looking into cases involving subjects who had previously diagnosed dental conditions so that I could develop an effective AMI 750 dental protocol for at-home users, dentists, and hygienists. I wanted to see if there was evidence that chronic infections in the mouth had any correlation to infection in other parts of the body, as had been suggested in Chinese medicine and other Western medical studies. The suggested AMI 750 protocol was designed for a full 6 weeks. Thermal images were taken at various intervals to check the progress of the therapeutic sound sessions. For some participants, the thermographs were taken every 2 to 3 days, while for others, it was at 3 and 6 week intervals. This method of tracking, which showed how effective sound could be in diminishing inflammation, proved to be astounding. Clients who had extensive dental work such as crowns, bridges, and root canals were finding that there were pockets of infection or inflammation that they were unaware of. After their sound therapy program with the AMI 750, the thermal images revealed that this innovative approach with Channel 3 was clearly diminishing the inflammation. The oxygenation of the cells with Channel 6 provided further support for the immune system. Other conditions were resolving after the full 6-week protocol with daily sessions on the AMI 750. With this important information, we could see how therapeutic sound could assist in preventing these dental conditions from worsening, and in some cases, even resolving the issue. All participants showed some level of improvement. The body is designed beautifully with the meridian pathways as the connecting rivers of life throughout. Whenever one system is challenged, the others in the body will reflect it in some way. Using sound to bring the systems back into harmony is very effective and can empower people to take their own positive steps until their oral health issues can be addressed or resolved. The AMI 750 provides a method for improving dental health and offers a great step towards prevention.